medical marijuana, or cannabis as it's more appropriately termed, works very well for neuropathic pain, and that's the condition that is best studied. Donald Abrams, who is an oncologist at University of California, San Francisco, has done some of the better work in that area. It also works for myofascial pain, muscle pain, and arthritic pain as well. The cannabinoids also have an anti-inflammatory effect, so they can reduce inflammation in the joints. They work through cytokines to reduce intra-articular inflammation. I think it works very well in conjunction with opiates, and many people are able to take lower amounts of opiates when they use cannabis in conjunction with that medicine.
The use of marijuana in the treatment of pain conditions is certainly controversial. About 17 states to date have permitted it, but it certainly conflicts with the federal statute, at least as it relates to the Controlled Substances Act. Now, because of the 17 different states are doing it, they're doing it in 17 different ways. And so this provides an awful lot of gray area, which is certainly a concern for physicians as well as healthcare patients. Well, if I were to recommend something that physicians should do in the context of medical marijuana, certainly is to follow the law. Now, of course, that's not very easy because the Controlled Substances Act is in conflict with states that permit medical marijuana. So for physicians, they should certainly check with their state medical boards about what the rules and what the laws are concerning medical marijuana and comply with those.
Well, one always has to consider the legal ramifications anytime you're talking about cannabis from a medical perspective. Certainly, I would not recommend that any clinician recommend the use of cannabis in a state where there's no law protecting patients. I work in Washington State, where we do have a law that protects patients and allows them to use it with a physician's recommendation. What I recommend is that clinicians follow the letter of the law exactly as it's written, and that they practice good medicine, meaning that the patient has a complete history and physical, including review of pertinent past medical records, the thorough physical examination, a review of current medications, and then a risk assessment, whether you use one of the standard, like an opiate risk assessment tool, to make sure that the patient is not inappropriate risk for addiction. If all of those criteria are met and the physician practices good medicine, then I do think that cannabis can be safely and appropriately used to treat a number of conditions, including neuropathic pain.
Currently, the Justice Department has said that they will not prosecute any physicians who merely recommend marijuana to their patients, provided, of course, that they are complying with the state law and it's quite clear and unambiguous as to their participation in that program.